A staggering rise in infant mortality rates has led Mississippi to declare a public health emergency, marking a critical moment for the state's health system. In a recent announcement, the Mississippi State Department of Health revealed that the infant mortality rate has surged to 9.7 deaths per 1,000 live births in 2024. This figure represents the highest rate in a decade, signaling a significant deterioration in the health outcomes for newborns. Based in Memphis, Tennessee, the Department of Health has sounded the alarm, emphasizing the gravity of the situation. Since 2014, a heart-wrenching 3,527 infants in Mississippi have lost their lives before reaching their first birthday. These statistics are not just numbers. They represent real families and communities grappling with profound loss. But here's where it gets controversial. Some critics argue that the state's response should have been more robust and timely. However, State Health Officer Dr. Dan Edney remains resolute, stating, "Too many Mississippi families are losing their babies before their first birthday. This is deeply personal to me, not just as a physician, but as a father and grandfather. Every single infant loss represents a family devastated, a community impacted, and a future cut short. We cannot and will not accept these numbers as our reality." Declaring this a public health emergency is more than a policy decision. It is an urgent commitment to save lives. Mississippi has the knowledge, the resources, and the resilience to change this story. It will take all of us, policymakers, healthcare providers, communities, and families, working together to give every child the chance to live, thrive, and celebrate their first birthday. The leading causes of infant deaths in Mississippi, according to the Department of Health, include preterm birth, low birth weight, sudden infant death syndrome, SIDS, and congenital malformations. These conditions often stem from underlying issues such as inadequate prenatal care, socioeconomic challenges, and limited access to healthcare resources. To tackle this crisis, the Mississippi Department of Health is implementing a comprehensive, multifaceted approach. This includes expanding prenatal care opportunities across the state, enhancing community health worker programs, and reinforcing the Healthy Moms, Healthy Babies initiative. And this is the part most people miss. Improving maternal health is seen as the cornerstone of reducing infant mortality. Better access to prenatal and postpartum care, stronger community support, and more resources for mothers and babies are crucial steps. Dr. Edney emphasizes, improving maternal health is the best way to reduce infant mortality. That means better access to prenatal and postpartum care, stronger community support, and more resources for moms and babies. Healthy women of childbearing age are more likely to have healthy pregnancies, which in turn lead to healthier babies. What do you think about the state's response to this crisis? Is it enough? Or should more be done to address the root causes of infant mortality in Mississippi? Share your thoughts in the comments below.